Welcome back to our channel. Today, we're diving into an important health topic that affects millions of people worldwide. We're talking about diabetes, a condition that impacts how your body uses sugar for energy. You may already be familiar with some of the common symptoms of diabetes, but did you know that your body could be sending unexpected signals as well? While diabetes is a serious health condition, there are some lesser-known signs that could indicate its presence. In this video, we're going to uncover 5 unexpected symptoms you definitely don't want to ignore. By understanding these hidden signals, you can empower yourself to take charge of your health and seek the right medical attention if needed. Have you ever noticed yourself making more trips to the bathroom than usual, especially during the night? Let's talk about why frequent urination can be a red flag when it comes to diabetes. In simple terms, when your blood sugar levels are high, which happens when your body isn't effectively using insulin, your body tries to get rid of that excess sugar through any means possible, and one of those ways is through your urine. Think of it like this. Your kidneys, those amazing filters in your body, are working overtime. They're trying to flush out the extra sugar, and to do that, they need more fluids, leading to increased urine production. You might find yourself waking up multiple times during the night just to use the restroom. Now, this doesn't mean every bathroom break is a cause for concern. We all have those nights. But if you're consistently noticing an increase in trips to the bathroom, especially if it's accompanied by other symptoms we'll be talking about, it's definitely something you want to bring up with your doctor. It's always better to err on the side of caution and get checked out. Remember, knowledge is power. The more you understand about your body and the signals it sends, the better equipped you are to take control of your health. We all get thirsty, right? It's our body's way of telling us to replenish fluids. But have you ever experienced a thirst that just wouldn't quit, no matter how much water you drink? This constant, intense thirst could be a sign of something more, especially when linked to diabetes. Remember how we talked about frequent urination? Well, that excessive urination caused by high blood sugar can lead to dehydration, which in turn triggers an intense feeling of thirst. Your body is playing catch-up, trying to make up for the fluids lost through increased urination. Here's the tricky part. Sometimes, people mistake this intense thirst as a sign of needing more sugary drinks like soda or juice. But those sugary drinks will only worsen the cycle, leading to even higher blood sugar levels and more dehydration. If you're constantly reaching for that water bottle and still feeling parched, it's essential to pay attention to your body. Talk to your doctor to rule out any underlying conditions like diabetes. While many of us might welcome weight loss, it's crucial to understand that sudden, unexplained weight loss can sometimes be a warning sign from our bodies. It's like a flashing red light saying, hey, something's not quite right here. When we talk about unexpected weight loss in the context of diabetes, it's often more pronounced and happens without any intentional changes to diet or exercise. You might be thinking, but wait, doesn't diabetes make you gain weight? And you're right, it can, especially in type 2 diabetes, where insulin resistance can lead to weight gain. However, in some cases, particularly with type 1 diabetes or when type 2 diabetes is undiagnosed and untreated, weight loss can occur. Here's why. In diabetes, your body struggles to use glucose or sugar for energy effectively. Since glucose is a primary energy source and it's not getting into your cells as it should, your body starts looking for alternative fuel sources. It turns to muscle and fat stores for energy, leading to weight loss. So, if you notice a significant drop in your weight without any clear reason, don't dismiss it as a positive change. It's essential to have a conversation with your healthcare provider to determine the underlying cause. We all experience fatigue from time to time. Life can be exhausting, but if you're feeling constantly drained, like you could sleep for a week straight and still wake up tired, it's time to listen to your body. Persistent, unexplained fatigue is another one of those sneaky signs of diabetes that often gets dismissed. Think about it. Your body relies on glucose for energy, right? It's like the fuel that keeps everything running smoothly. But when you have diabetes, your body can't use glucose effectively, so that readily available energy source is essentially out of reach. It's like trying to run your car on fumes. It's just not going to work very well. This energy shortage at a cellular level leaves you feeling exhausted, no matter how much sleep you get. You might find it difficult to concentrate, feel weak, and lack the energy to do the things you normally enjoy. The fatigue associated with diabetes can be debilitating, impacting your quality of life significantly. If you're experiencing persistent fatigue that's interfering with your daily routines and isn't relieved by adequate rest, it's crucial to consult a medical professional. Our vision is precious, and any changes to our eyesight can be concerning. While age-related vision changes are common, sudden blurred vision can sometimes be an early warning sign of diabetes, especially if it's fluctuating or comes and goes. Here's why diabetes can impact your vision. High blood sugar levels can damage the tiny blood vessels in your eyes, particularly those in the retina, the back of your eye that senses light. This damage can affect the retina's ability to function properly, leading to blurred vision. Imagine looking through a window that's been splashed with water. That's kind of what blurred vision can feel like. You might have difficulty focusing on objects both near and far. The severity of blurred vision can vary, and in some cases, it might even go unnoticed initially. Now, it's important to note that not everyone with diabetes will experience vision problems, and blurred vision can be caused by a variety of factors. However, if you notice any sudden changes in your vision, especially if you have other risk factors for diabetes, it's crucial to schedule an appointment with your eye doctor or healthcare provider as soon as possible. We've covered a lot today, and I hope this information has been helpful in shedding light on some of the lesser-known signs of diabetes. Remember, knowledge is power when it comes to your health. If you or someone you know is experiencing any of these symptoms, it's important to consult a healthcare professional. Don't brush off these signs or try to self-diagnose. Early detection and treatment are key to managing diabetes effectively and preventing complications. Don't forget to like, share, and subscribe for more health tips and information. And as always, thanks for joining me on this journey to better health.